Hello, everyone, and welcome once more to my channel, Background Health. On today's episode, I'll be showing you the different symptoms of stroke in the hope that if you recognize it, you'll be helping somebody get medical attention. Did you know that in stroke, the sooner you are diagnosed, the sooner intervention can be given and the better your outcome? However, what is not well known is that different people can have different symptoms of stroke, and some are not very easy to recognize. And that's because of what I'm about to show you. Before I proceed, I'll show you the first set of slides, which will help you understand why different people have different symptoms of stroke. And thereafter, I'll show you those different symptoms in the hope that the sooner we recognize, the better, and the sooner we can render care for better outcome. In the first place, I compare the human brain like a mansion, well lighted electricity. As you can see, this mansion, all the rooms are well lighted, everything is functioning at night like it's supposed to be. However, for that function to function, you have to see that every room is controlled by a different electrical switch in the control panel. If one of those switches is turned off, the electrical supply to that area or that appliance will not function as it's supposed to do. Here's a house well lighted on the lower level at night, and the one room upstairs well lighted, but the other rooms upstairs do not have electricity. This is similar to what we see in stroke, where some areas have good blood supply and areas without good blood supply are like areas that have had a stroke. This diagram shows you a simplified diagram or cartoon illustration of the human brain. Each area is labeled for simplicity. Each area have different function, and therefore a stroke affecting any one particular area will have different type of symptom compared to a stroke affecting a different area. Here is a simplified diagram of the different blood supplies to the brain. As you can see, some blood vessels are bigger than others, and they'll go different areas. The type of symptom somebody experience and the severity of symptoms experienced depend on the size of the blood vessel that is blocked and the area that is supplied and the function that that area serves. Now, therefore, I'll show you some of those symptoms after a brief discussion. So, stroke is simply the sudden cut off of blood supply to an area of the brain. The symptoms, as I mentioned, will be different depending on the function and the size of the blood vessel that is involved. Here, therefore, are some of those symptoms that one can expect. Here are faces of two individuals who have experienced stroke. In this person is supposed to be looking this direction, but this eye is not able to move beyond the midline. And so this person will be experiencing sudden onset of double vision. On this picture, you see this individual is supposed to be moving towards this direction, but this eye is unable to move beyond the center point. This person also will be having double vision. Similarly, they may even be missing vision in some areas of their eye. On this slide, you see a man who has had a stroke affecting his facial muscle. This area of his face is paralyzed, and therefore you see the slanting, and also you see the sudden drooping of the lips here. This person, when he attempts to talk, his speech will be very difficult to understand. He will be slurring his word. If he try to drink water, fluid will be dripping through here. He will be drooling, among other things. In this picture, this man has had a sudden stroke, and you can see here his part of his face is drooping and drooling. His facial muscle, especially around the muscle of the lips, are not symmetrical, they are not equal. Another major symptom of stroke, which many people are able to recognize, is sudden weakness on one side of the body, which may include loss of sensation. In this diagram, you see this person has had a stroke and unable to move this arm, this leg, and will be having facial drooping, may have eye problems on this side. If you try to walk, you will not be able to walk. In this diagram, this person has had a stroke that made it difficult for him to use this arm here. This is an old stroke. This person's arm is so weak and is beginning to have contraction of this arm here. Next major problem with stroke is balance. When you see somebody suddenly begin to walk like they've been drinking, like they're drunk, that's a type of stroke as it depicted in this diagram. This person is going to show us problem with balance following a sudden stroke. As you can see, he's having difficulty walking. Here you see it again. He will try to walk, but you can see lack of balance following a sudden stroke. Other symptoms which I have not shown include difficulty recognizing familiar objects. For instance, you can show the person a key, he or she may not recognize it, whereas 5, 10 minutes ago, he or she knows all that. You may show them a pen or a car, they may not even know how to recognize that or how to say the name. They may not recognize the word that you are saying to them. They may use words appropriately when they speak, but when you tell them the same word, they may not be able to recognize that. So there are so many different ways to recognize stroke, but you need to pay attention to the sudden changes in the person next to you, because the sooner you do that, the sooner they'll get help and the better their outcome if they get the necessary help. Thank you. Until next time.